So welcome to the Alpha and Omega Health Podcast. I'm Dr. Tri Myers.
Rachel Myers.
So today, or actually this month, is Foot Health Month. So guess what we get to talk about today?
The feet.
The feet.
Let's get started with the Alpha and Omega Health Podcast with Doctors Rachel and Tri Myers.
In your office, how many people deal with some type of foot problem? Do you get that a lot?
Yes, but people usually don't think that we can do anything. So actually, they usually don't say anything at all. Mm-hmm. Most of the time, we'll start to hear about it when they're through an active plan and they're into their maintenance plan. So that's honestly probably on us because we aren't telling people that we do that.
Yeah, that's why we have this.
Yeah. So why are the feet important to your whole alignment?
Sure. So we talk a lot about feet, especially at the very beginning.
When he says we, he means him.
My
and
office,
that I'm
Omega.
failing. That's what he's trying to do there.
Maybe. You guys have the same equipment, so there should be
Hey,
a little
anyway,
ownership here, right?
Let's move on. I did own it.
It's okay. You did. So what we mainly talk about is like biomechanically. So biomechanically, body, mechanically, how you move, mechanics. So can you put them all together? How does your body move? Foot's pretty darn important. It contacts the ground. If your feet, the arches are fallen, it causes the knee to internally rotate, kind of drops that hip a little bit, causes the shoulder to kind of compensate also. So it causes compensations upstream. So a lot of times people will come into the offices of back pain, hip pain, knee pain, whatever. A lot of times it's a foot dysfunction also.
So we have 3 arches to our feet.
Yep.
Do you know the names of them? Let's say this is the bottom of your foot.
Okay.
Okay. Here's the inside arch, which everyone knows about the inside arch, right?
Yeah, you can go buy a orthotic at Walmart and they always talk about this
that. I mean, a shoe that you buy anywhere supports that inside arch.
Sure.
Do you remember the name of that one?
Yeah, medial longitudinal arch.
Great. And then you have one across the balls of your feet, which people don't typically even know about.
Sometimes like that you might get these little teeny circle things that you could put on top of in your shoe or in your orthotic. It kind of boost that thing up. Typically people who have like metatarsal pain around the toes, they'll know this one because they have to have this one.
Yes. So do you remember the name of that one?
Your metatarsal arch?
No.
Transverse.
Yes.
Tricked me for a second.
And then the one that I think most people don't even realize we have is the one on the outside of our feet, which truthfully is the one that everyone does not have because of our shoes, really.
Sure, yeah.
But what is that one called first?
I don't even remember that one.
Wouldn't that be the lateral?
Ah, you got your medial and lateral. Go figure. Super complicated, right? But anyway, like she said, 3 arches in your feet. Everyone kind of always remembers the medial one. Maybe some people know about the transverse one. That lateral one, people just don't really think about it. So
before we go on, I want you guys to pull out a pair of your shoes that you wear all the time, and I want you to look at them. I probably should have had my shoe off. Yeah, so I want you to look at it like this, and look at the edges of the heels. What would you say, 90% of people's shoe wear is they wear on the outside of their shoe and it becomes angled, so then it causes your entire foot to roll in every time that you're walking. So definitely make sure you go and buy some new shoes if it looks that way. The next thing that we want to talk about, you were going to go off on some things there.
A little tangent. Think of your foot as a tripod, okay? Here, heel, big toe, kind of around the pinky toe. So there's your medial arch, transverse arch, and then the small one on the side, the lateral arch, okay? So those are where your pressure points should be. Now we have a device in our office. It's a foot scanner. It does a 3D model of what the bottom of the foot is. It's pretty easy. All it does is take like a little red light, scans the foot, so that way it's kind of looking to see, think of those.
It's looking to see where your
the distance. Is. So think of those lights that people like contractors use. They'll put it up on the wall, shoot the red light to another thing, and kind of look at the distance. That's all I was trying to do, is looking at distances between different areas of the foot. So then it gives you a 3D model, so we can kind of turn it and be like, oh man, look at that transverse arch. It's collapsing, or now it's getting so bad that medial arch like is starting to really touch the glass that you're actually standing on. Whenever we take these scans and say it's like, oh, you are it would be beneficial for you to have a custom orthotic, we send the scans in, they custom mold the way your foot 3D model was for your foot, so then it can be supportive.
Let me say something about that. Yep, you're about to pull them out. This is important because you guys will go all sorts of places and get orthotics. But like we talked about those 3 arches, you have to support all 3. So like this is from Foot Levelers. This is who we use. And so it's going to have the inside arch, the one across the balls of your feet, and the outside arch. But you can go to Walmart and, like Tri said, you can get some that'll just support the inside. What's also important in an orthotic is making sure that it's bendable. You don't want it to be so hard that your foot doesn't move at all. It's really important that your foot moves. There are joints there. Joints are supposed to move. So remember that.
So the hard plastic orthotics, think of them like a cast. It's good for whenever something's really messed up, like a ligament's torn completely, like you need some type of support. Kind of like you sprain your ankle, you need something to limit the range of motion. The foot has tons of little bones all around it, and I want you to think of more of a tank, you know, the little wheels with the tracks on it, so whenever it goes over a log, like it's supposed to move, that's what you want your foot to do.
Those were some nice dance moves.
Yeah, I learned from the best. But that's what these arches are designed to do. Like she said, 3 arches, and it's soft, movable, so you still want your foot to function well. You're just trying to stop the excessive movement that it's doing.
Okay, so we went over a lot of foot stuff, but
Yep.
why is this important chiropractically and for your spine?
Yeah. So first off, if the arch, like if your foot's supposed to be this length and the tissue on the bottom part of the foot, your plantar fascia, all of a sudden now that foot is kind of elongating, losing that shape and integrity, is starting to pull on the bottom tissue of the foot, causing plantar fasciitis. Okay, so there's number one.
Coming in with that.
Then think of like if it's same mechanism, but if it's dropping and it's pulling on that heel, now you have heel spurs.
spur.
Okay, then also it's causing the calcaneus, which is your heel bone, to do like a weird clockwise maneuver, and it's putting pressure on different, it's like rotating it inside. Now you have Achilles issues, calf pulls, and it trickles its way up. Now, the thing is, when that arch starts to collapse, it will internally rotate at the knee. So there you have.
So then your knee buckles in.
Now you have your medial meniscus problems over time. It causes issues there.
That's where someone's going to complain that they have a lot of pain on the inside of their knee.
Okay, then so I have this a lot in my runners. So they have a lot of ground foot contact. A lot, and just repetitive movements. So if the knee is going in over and over and over, the job of the IT band
Where's the IT band?
So attached to the outside part of the knee, and then it runs all the way up to the side of the hip. So its job is to stop internal rotation of the knee. So if it's doing it
really
over
lax.
and over and over, then it has like really dense. It's getting that tissue super tight. So everyone will typically foam roll the outside part of their leg. I mean, it feels better for a little bit, but then it comes right back because you're not fixing the thing that's causing the internal rotation. You're just stopping the tension and the buildup of pressure on the IT band.
So what we want to say about that is, yes, massage, trigger point work, all super beneficial.
100%.
But we have to fix the structural problem.
So like we talked about, you could do some adjustments on the foot, you can do the muscle work on the foot, you can do all this other stuff to try to help your overall alignment, but we recommend an orthotic in there to help support that alignment that you just work so hard to do. So
one of the things that probably people also want to know about is, how do you adjust a foot?
Sure.
So I know your technique is a little different.
Okay.
I'm always bashing on your technique. But we use an instrument, as you all know, and so with the instrument, we're able to pinpoint and adjust if it's the little knuckles of your foot, and we need to adjust those to help get that arch along the balls of your feet.
Arch. Mm-hmm.
Yep. If we need to get that back where it needs to be, we'd adjust in there. We can adjust on the sides. We can adjust the heel, the ankle, all of that, getting it kind of back to where it needs to be, and then getting the support from the orthotic or from exercises that we would give as well. Because if you think about like a ballerina, like most ballerinas that are doing point, they're going to have those really high arches. It's because they've worked those muscles out. Most of us are not working those muscles.
Correct.
So that's where it's really beneficial. It's just like what we do with our spines, right?
Yep.
Like we're going to get everything adjusted, but then we would give you exercises to stabilize it.
So whenever you look at people's feet, 90% of the time, it's the people who have a collapsed arch. So there's your flat foot mentality. So other 10% is kind of like the ballerina. It's a high arch, a very rigid foot. So you're dealing with two different types of problems. You have one that has lacking stability and it's almost loose, like the joints are really loose, so it doesn't function very well. The other one is almost like it's just a claw, like it doesn't want to do anything. Like you can put a lot of weight on it, but it doesn't want to move. Both are a problem. We want to try to get that middle ground. So orthotics are typically mainly designed for the 90% where it's trying to stabilize that area. But typically when people have the rigid foot, you need to get that tissue to move, you need to get it adjusted, etc. Because if not, that area is designed for tons of mobility and now it's not. And then that will 100% compensate upstream. So in the ankles, knees, lower back, etc.
So all this to say, the feet are really important.
Yep.
A lot of times I will say it's kind of like the foundation of your whole spine.
Correct.
Because if you get misalignments in the foot, it'll go to the knees, the hips, the low back, the mid back, and then into the neck.
Anyway, back when I was younger, playing sports and everything, like I was blessed enough to not really get hurt in football for the most part, but playing church softball, man, It was pretty dumb. Like for some reason I would like lunge, I was a young kid with all the 30, 40-year-olds and they're like pumping me on because I'm the only one able to actually run all the way like I'm supposed to.
Where, like in that age bracket, how do you know?
Sad. Tear. But, so I lunged for first base one time, I was trying to run out a throw, and my foot was on it, but then my ankle was on the ground. So, not too good. I wound up breaking my ankle, spraining it up pretty bad, etc. Anyway, a year goes from there, and then all of a sudden my left shoulder started hurting out of nowhere. I didn't really do anything to it. Rehabbed it, muscle work, adjustments. I did all kinds of stuff to the shoulder. I actually found a doctor that actually was in my school who actually knew what he was talking about and was like, he did all the assessment and like, man, what's going on with this ankle? And I'm like, I broke it a long time ago, sprained it real bad. And he was like, it's still loose, causing compensations all the way up into my opposite shoulder. Guess what? I rehabbed my ankle, work on that, and my shoulder pain went away. So I know that's kind of weird and how it's all interconnected, but it is. I have personal experience, and that's kind of what got me down this rabbit hole of looking at the whole body instead of just spot treating certain things.
Yep.
So if that is
Ankle
you,
bone's connected to the shoulder bone.
I know. So if that's you and you're kind of frustrated with like, hey, the spot treatment stuff isn't working, go find someone who
Whole
knows what they're
body.
talking about.
Check
So
it
get
out.
get assessed, whole body, foot scan, all of it. All right. So if you have any questions, if that's you, comment below. We love to talk with you, kind of chat with you.
Your foot bone connected to your ankle bone connected to your leg bone, now your leg bone connected to your